Every morning you make your coffee, and every morning you are one ingredient away from turning that cup into the most targeted natural anti-inflammatory protocol you have ever given your body. One powder, half a teaspoon, stirred directly into your cup before your first sip. And what happens inside your body over the next 30 to 45 minutes, as the caffeine opens your blood vessels, accelerates your circulation, and dramatically increases the absorption rate of everything you have consumed alongside it, is something that most chronic pain sufferers have been missing their entire lives without ever knowing it was available to them. I am Dr. Michael Kent, and today I am giving you the one powder that your morning coffee has been missing, the one addition that turns your daily ritual into your most powerful daily healing practice. And the science behind why this specific combination works in ways that taking this powder at any other time of day and any other liquid simply cannot replicate. Before I get into everything, I need you to do one thing right now. Scroll down to the comments section and drop your age and your city, just those two things. And tell me one more thing specifically for today's video. How many cups of coffee do you drink every morning? Just a number. 1, 2, 3, whatever it is. Drop it in the comments right now before you forget. I personally read every single comment on this channel, and I want to know exactly who is watching today. Age, city, and how many morning coffees. Drop it right now. Now let me start with the caffeine science, because understanding what caffeine actually does inside your body beyond alertness and energy is what makes everything I am about to share with you feel not just interesting, but immediately urgent and actionable. When you drink your morning coffee on an empty or near-empty stomach, which most people do because coffee is typically the first thing consumed in the morning, several specific physiological events happen in rapid sequence that create a unique and remarkably powerful absorption window. First, caffeine stimulates the release of gastric acid and digestive enzymes that prime your gut lining for absorption. Second, caffeine accelerates gastric emptying, the rate at which the contents of your stomach move into your small intestine, which is where the vast majority of nutrient absorption happens. Faster gastric emptying means faster delivery of whatever you have consumed alongside your coffee to the absorption surface of your small intestine. Third, caffeine stimulates the release of adrenaline, which dilates peripheral blood vessels and increases cardiac output, meaning your circulation is moving faster and more efficiently, delivering absorbed compounds to your target tissue more rapidly than in a resting state. And fourth, and this is the part that most people have never heard, caffeine has a direct enhancing effect on the intestinal transport proteins that carry specific compounds from your gut lumen into your bloodstream. Certain natural compounds that are transported into the bloodstream via specific carrier proteins have their transport rate significantly enhanced in the presence of caffeine. The result of all four of these simultaneous effects is a morning absorption window, specifically in the context of hot coffee consumed on a relatively empty stomach, that is measurably superior to any other time of day for delivering the powder I'm about to describe to your bloodstream at maximum concentration and maximum speed. Now let me tell you what that powder is, and then I am going to walk you through exactly what it does inside your body in a level of detail that will permanently change the way you think about your morning cup. The powder is lion's mane mushroom, a medicinal fungus that has been used in traditional Chinese and Japanese medicine for over 2,000 years, and that modern neuroscience has now identified as one of the most remarkable natural compounds for nerve tissue health, inflammatory regulation, and chronic pain management that exists in the natural world. Lion's mane mushroom in its powdered form, specifically a dual-extracted powder that captures both the water-soluble beta-glucan compounds and the alcohol-soluble hericinone and irinocine compounds, dissolves readily in hot liquid, makes your coffee slightly creamier and earthier in flavor without being unpleasant, and delivers its active compounds into the caffeine-amplified absorption environment of your morning cup in a way that maximizes their bioavailability and their speed of delivery to your nerve tissue, your brain, and your inflamed back and joint tissue. Let me explain the two categories of active compounds in lion's mane and what each one does, because the distinction between them is important and most people who have heard of lion's mane only know about one of the two. The first category is beta-glucans, long-chain polysaccharide compounds that are water-soluble and that have been extensively studied for their immune-modulating and anti-inflammatory properties. Beta-glucans in lion's mane interact with specific receptors on your immune cells, particularly your macrophages and dendritic cells, and modulate their activity in a way that reduces the production of pro-inflammatory cytokines while maintaining the immune system's ability to respond to genuine threats. For chronic pain patients whose inflammatory response has become dysregulated, stuck in a state of chronic low-grade activation that sustains tissue inflammation long after any acute injury has healed, this immune modulation is profoundly relevant. The beta-glucans are essentially recalibrating your immune system's inflammatory set point, bringing it back toward the balanced state where inflammation resolves appropriately rather than persisting indefinitely. And because beta-glucans are water-soluble, they dissolve completely in your hot coffee and are immediately available for absorption in the caffeine-enhanced gut environment. The second category of active compounds is even more remarkable, and this is where lion's mane becomes genuinely unique among natural compounds for pain and nerve health. Hericenones, found in the fruiting body of the lion's mane mushroom, and erinacines, found in the mycelium, are small lipophilic molecules that have the extraordinary ability to cross the blood-brain barrier and stimulate the production of a protein called nerve growth factor, or NGF. Nerve growth factor is one of the most important proteins in the entire nervous system. It is the primary signal that tells nerve cells to survive, to maintain their axonal connections, to repair damaged myelin sheath tissue, and to regenerate after injury or chronic inflammatory damage. In the context of chronic back pain and nerve pain specifically, where years of ongoing inflammation have damaged the myelin sheath surrounding nerve fibers and disrupted normal nerve signal transmission, NGF stimulation is not a peripheral benefit. It is a direct intervention in the biological process most responsible for the nerve hypersensitivity, the radiating pain, the burning and tingling sensations, and the abnormal pain signal transmission that characterize chronic nerve-involved back pain. Your nerve tissue needs NGF to repair itself, and lion's mane is the only natural compound known to science that meaningfully stimulates NGF production from the outside, through dietary or supplemental intake rather than through direct injection or pharmaceutical intervention. Now here is where the coffee combination becomes specifically and powerfully relevant to the erinacines and hericenones. These compounds are lipophilic, meaning they are fat-soluble rather than water-soluble. Fat-soluble compounds generally have lower oral bioavailability than water-soluble compounds because they require the presence of dietary fat and bile acid secretion to be properly absorbed. However, and this is the part that makes the morning coffee delivery method so specifically effective, caffeine stimulates bile secretion from the gallbladder even in the absence of dietary fat. The caffeine in your morning coffee essentially mimics the bile-stimulating effect of a fat-containing meal, creating the bile acid environment that the lipophilic hericenins and erinacines need for efficient absorption, without requiring you to consume fat alongside them. This is a specific and meaningful biochemical advantage of the coffee delivery method over consuming lion's mane powder in water or in a non-caffeinated beverage. The caffeine provides the bile stimulation. The bile enables lipophilic compound absorption. The result is that more hericenones and erinacines reach your bloodstream, cross your blood-brain barrier, and stimulate NGF production than would reach these targets through any other common delivery method. The dose that produces meaningful clinical results in the research on lion's mane for nerve health and inflammatory pain is between 500 milligrams and 1 gram of dual-extracted lion's mane powder daily, which translates to approximately half a teaspoon to 1 full teaspoon depending on the density of your specific product. Dual extracted is critical. A powder that has only been water extracted will contain the beta-glucans but will have lost most of the hericenones and erinacines that require alcohol extraction to be concentrated. Look specifically for lion's mane products that state dual extraction or hot water and alcohol extraction on their label. Add your half teaspoon to 1 teaspoon to your coffee while it is still hot. Stir thoroughly for 20 to 30 seconds until fully dissolved, and drink as you normally would. The flavor addition is mild, slightly earthy, and slightly umami, with a gentle creaminess that many people find actually improves the texture of their coffee. It does not taste medicinal. It does not taste unpleasant. Most of my patients forget within a week that they have added anything to their coffee at all because it becomes so seamlessly part of the existing ritual. The timeline of results follows a specific and predictable pattern that I want to walk you through so that your expectations are accurate and so that you do not stop before the most significant benefits have had time to develop. In the first 1 to 2 weeks, the beta-glucan immune modulation begins shifting your systemic inflammatory environment. Most patients notice subtle changes during this period: slightly less morning stiffness, a quality to their pain that feels marginally less insistent, days where the baseline discomfort is slightly lower than their recent average. These early signals are real but subtle. The recalibration of the inflammatory set point is happening at a cellular level and has not yet fully expressed itself in dramatic symptom reduction. Between weeks 2 and 4, the NGF stimulation from the hericenones and arenosines begins producing its first measurable effects on nerve tissue health. Patients begin reporting changes in the quality of their nerve-related symptoms. The burning and tingling that accompanies chronic nerve inflammation begins to soften, the hypersensitivity of the affected nerve pathways begins to reduce, and the sleep disruption caused by nighttime nerve pain begins to improve as the nerve tissue becomes less reactive and less pain-amplifying. Between 1 and 3 months of consistent daily use, the cumulative NGF-driven nerve tissue repair produces the results that patients find most transformative: a genuine, sustained reduction in the chronic nerve hypersensitivity that has been amplifying their pain experience far beyond what the underlying structural problem alone would produce. Now I want to tell you about Charlotte. She is 53 years old, a landscape architect from Colorado who had been dealing with chronic lower back pain with a significant nerve pain component for 2.5 years when she first came to see me. Charlotte was an early riser, up every morning at 5:30, coffee in hand by 5:45, at her drafting table by 6. Her morning coffee ritual was non-negotiable. It was the one consistent, reliable, personally meaningful part of her day that her chronic pain had not managed to take from her. She had tried multiple interventions for her back pain over the 2.5 years: 2 courses of physical therapy, 1 epidural steroid injection that gave her 6 weeks of meaningful relief before wearing off, a comprehensive nutritional protocol that had helped modestly with her baseline inflammation, and several individual supplements taken at various times of day with inconsistent results. She was not in the worst pain of her life when she came to see me. Her previous interventions had brought her from an 8 or 9 out of 10 at her worst down to a consistent 4 to 5, but she had been stuck at that 4 to 5 for over 8 months and could not find the intervention that would move her further. She described her remaining pain as primarily nerve-related, a burning quality that radiated from her lower back into her left hip and down the back of her left thigh, present every day without exception, worst in the mornings and again in the evenings. When I described lion's mane mushroom powder to Charlotte, and specifically the coffee delivery method that exploits the caffeine absorption amplification, her response was immediate and practical. She said, "Dr. Kent, if I can add something to my existing morning coffee and it helps my nerve pain, that is the easiest thing anyone has ever asked me to do." She was not a difficult patient to convince. She started the protocol the following morning: half a teaspoon of dual-extracted lion's mane powder in her 5:45 coffee, every single morning without exception, because for Charlotte, her morning coffee was already an exception-free ritual. Adding the powder to it simply meant the ritual now had one more step that lasted approximately 20 seconds. At the 2-week mark, she messaged my office saying that her morning stiffness had reduced noticeably and that the burning quality of her nerve pain felt slightly less intense than her recent baseline. She was cautiously optimistic but not yet dramatically changed. I told her to continue and that the most significant results were still ahead of her. At the 6-week mark, she came back for a follow-up appointment. She sat across from me, and the first thing I noticed was that she was sitting differently, more comfortably, less guardedly, without the subtle, constant shifting and repositioning that chronic nerve pain sufferers do automatically and unconsciously to manage their discomfort. She rated her pain at a 2 to 3 out of 10, down from a consistent 4 to 5 that had been her ceiling for 8 months. She said the burning quality that radiated into her thigh, the symptom that had been most resistant to every previous intervention, had reduced by what she estimated as 70%. She said, "I honestly thought that burning was just something I was going to have to live with forever. It has been there every single day for 2 years, and it is almost gone." I asked her what she had changed in the previous 6 weeks beyond the lion's mane powder. She said nothing. Same diet, same exercise, same sleep routine, same everything. Just the powder and the coffee every morning. Charlotte continued the protocol. At the 4-month mark, she rated her average daily pain at a 1 out of 10. Essentially a background awareness rather than a clinical pain level. She told me she had recently completed a full-day site visit for a major landscaping project, on her feet, moving, bending, assessing terrain, for 7 consecutive hours without stopping, without pain medication. Without her back becoming the primary thing she was managing throughout the day, she said, "I got home that evening and realized I had not thought about my back once all day. That is the first time that has happened in 2.5 years. Here is your complete morning protocol. Purchase a dual-extracted lion's mane mushroom powder from a reputable supplement company that clearly states hot water and alcohol dual extraction on its label and provides third-party testing certificates confirming active compound concentrations. Add half a teaspoon to 1 teaspoon to your morning coffee while it is still hot. Stir thoroughly for 20 to 30 seconds. Drink as you normally would. Do this every single morning without skipping because the NGF stimulation and immune modulation that produce the most significant results are cumulative processes that depend on consistent daily compound delivery. Give the protocol a minimum of 6 weeks before evaluating your results at the nerve pain level. While the anti-inflammatory beta-glucan effects begin within the first 2 weeks, the nerve tissue repair driven by heracinone and arenosine NGF stimulation builds progressively over weeks and months. One important note, if you have a known mushroom allergy, consult your physician before beginning this protocol. If you are pregnant or breastfeeding, discuss with your healthcare provider before use. And if you are immunocompromised or taking immunosuppressant medications, the immune modulating properties of beta-glucans warrant a conversation with your specialist before starting. Right now, before this video ends, scroll down to the comments and leave your age and your city. Tell me how many morning coffees you drink, and if you start this protocol tomorrow morning, come back in 6 weeks and tell me what changed in your nerve pain quality. I read every single comment personally. Charlotte went from a 4 to 5 that had been her ceiling for 8 months down to a 1 in 4 months, from one addition to her existing morning ritual. Your morning coffee is already part of your day. Tomorrow morning it becomes part of your healing. I am Dr. Michael Kent, and I will see you in the next video.